What do you think, Elaine? We could maybe leave it till about 3 minutes past or something?
Yeah, let's give it till 3 minutes past, and then we'll get started. There's still people coming in.
Brilliant. And people can, obviously join a bit later, and that's no problem.
Yeah.
And I'm just glancing through the names of attendees, and there's a couple of names that I've seen or met before, but not that many. And it's thanks for folk for showing up, and for those who are on screen, it's nice to see faces, and those who aren't, that's okay. Okay, Elaine, I think I might just jump in at this point and get started, and then as other people join, then we can be sure to let them know as well. Okay, welcome everyone, and thanks to the UK HACC for having us. My name is Malcolm White, and I've got my colleague and Director of Clean Air, Larissa Lockwood, here as well. So I've got a presentation which I'll share, and hopefully people will have seen the agenda, but essentially we're going to be talking about a project that ran about a number of GPs across England talking to their patients about air pollution, and then we'll be looking at the findings and then having a discussion afterwards as well. Okay, so I've got my presentation. And then hopefully that's come up. Okay, and I can't really see faces here, so if there's any issues or burning questions, then feel free to come off of mute and then just jump in. Or I believe that there is a chat function as well if people want to start putting in questions that we can address at the end. So yeah, welcome. As I said, my name is Dr. Malcolm White, and I've got my colleague Larissa Lockwood as well, who is the Director of Clean Air at Global Action Plan. We as an organisation do a lot of work relating to air pollution, and in general we aim to mobilise action on the systems that impact human and planetary health for the better. Just as a very short plug, we run Clean Air Day, which many of you will be familiar with. It's the UK's biggest day of the year in terms of fighting air pollution, and it mobilises hundreds of organisations and individuals up and down the country, including the schools, health sector and businesses. And it's a really amazing day, which I think next year will be running on the 15th of June, if I'm not mistaken.
That is correct. Malcolm, just to say your slides aren't moving on for us.
Oh, I see. They are for me, which is unfortunate. Let's see how we can...
In the meantime, everyone can put the 15th of June in their diary for Clean Air Day.
Right, I think short of stopping sharing and trying again, I don't have much in the way of options right now.
Malcolm, if you can't get it to work, you can send it to me, and I can try and share. But give it another go.
Yeah,
maybe you're on a different window.
So far everyone was just seeing the pink initial page, is that right?
That's right.
Yeah. Okie dokie. what I might be able to do is open it as a tab. And then share from the browser. So let's try this. Okay, hopefully people will be seeing this, and then let's try this out. So does that move on?
Yeah, that's working.
Great. I'm glad to see technology was our friend in the end. So yes, this was my Clean Air Day slide and plug, as I mentioned, and then moving on. I mentioned we've got an agenda, and essentially we've done some welcomes and introductions already. Would be delighted to hear who is with us in the call today. So if anyone wants to, say their name, position, and location, then that'll be great for us to see afterwards as well, and have everyone starting to join in with questions. And we'll be talking about the health impacts of air pollution and the sort of overall UK context in a global picture. And then we'll be moving on and talking about the National Primary Care Project, which is the main project that the UK HACC Global Action Plan and Imperial College London partnered on with funding from DEFRA as well to deliver the project. We'll be talking about some recommendations following this project, and actually one which was very similar and ran at the same time. More details later. And then we've got a good sort of 20-minute chunk of time, hopefully, to discuss and open up the floor to see how we bring this into the mainstream of the medical curricula, etc. And then we'll be closing. So in terms of some of the global picture, we can see here that air pollution as a part of total pollution really is a major cause of mortality around the world each year. Now, this picture here of total pollution at the end actually includes things like water pollution, etc. But well over 6 million deaths a year, closer to 7 million, are caused by air pollution, estimated around the world. And as you can see, that's more really than malnutrition, drug and alcohol abuse, and HIV/AIDS really combined. So it's very significant numbers of people dying each year, and it really feels like the elephant in the room that isn't being talked about. If you look at the funding for, say, the HIV/AIDS issue, then that's well over $600 million a year, whereas air pollution really only has about $40-50 million a year in comparison. And we can unfortunately calculate that just for particulate matter 2.5, which essentially means tiny particles that constitute one of the types of air pollution, they unfortunately around the world leads to a decreased life expectancy of 2.2 years to the average person. So really very significant. Now, a couple of slides or images here about the UK context. Unfortunately, it really is a massive problem in the UK, even if it's not as large as some developing countries, still leading to 36 to 40,000 deaths each year in the UK. Creates a lot of problems in terms of employment and sick days. And in terms of the overall financial and social cost, it's estimated to be in excess of £22 billion each year in the UK. In terms of how we see this in our sort of front line of medicine, this really, is very significant in terms of it brings forward over 20,000 respiratory and cardiovascular hospital admissions each year in the UK. So that's an enormous burden on our NHS, which could be dealt with if we manage to tackle air pollution effectively. A quick note on some of the sources of outdoor air pollution, and then we'll move on to indoor. Now, the biggest contributor in the UK now is transport, and that historically would have been comparatively less with, say, coal-fired power stations But certainly industry and energy production still has a significant impact. And then there are some natural sources and some sources relating to farming. This produces a number of primary pollutants, which includes CO2, of course, nitrogen oxide, NO2, sulfates, carbon monoxide, hydrocarbons, and small particles. And unfortunately, this cocktail mixes in the atmosphere to create secondary pollutants, which are also harmful to human health. So there really is a wide variety of different types of air pollution. As I mentioned, transport is one of the major contributors in the UK. And this map of Islington in London, you can really see this measuring nitrogen dioxide, one of the major health impacts air pollutants in the UK. You can see that it really spikes along the roads in particular. And as you move down in towards central London, the baseline level of air pollution is generally in excess of what was the legal limit. And the legal limit in the UK, unfortunately, is not particularly ambitious, with the WHO having brought out much more ambitious targets. The UK is in the process of re-evaluating its targets to see how ambitious they're going to be, but our suspicion and their targets, we don't think are necessarily going to be ambitious enough, and I think more to be said on that, definitely. In terms of just a quick look at some of the sources of indoor air pollution, certainly, indoor heating, gas boilers and cooking, are significant contributors, especially if they're less effective systems. They might have gas leaks or carbon monoxide produced through inefficient burning. There are many things in terms of the carpets and curtains, fabrics around the home, paints, and many of these will release volatile organic compounds, VOCs as they're called. And then there are of course many things such as cleaning products, and if you have a very damp house due to a poor housing situation, then you might have mold and mildew, which unfortunately are significantly impactful towards the health of our populations. That sort of demonstrates, in some sense, the greater impact that air pollution has on the socially deprived. So if you have poor quality housing and poor quality, say, heating around the home and everything, then that can continue to worsen your health outcomes. So just a quick note about how this air pollution gets into the body. Well, the obvious route is through the lungs. So the inhalational route, you breathe it into the body, and this is the gases and the small particles, some of which are caught in the lungs and actually cause damage there, some of which are expectorated. And then having crossed the lung-blood barrier, it can get into the body and unfortunately really start to cause some issues at that point. This slide is mostly looking on the cardiovascular effects, which is actually the largest cause of mortality associated with air pollution. And as you can see, there are significant impacts such as arrhythmias, cardiovascular inflammation that can lead to increased myocardial infarction, and that has effects throughout the cardiovascular system as well in terms of strokes and blood clots, etc. Now, this picture was kindly taken from Sir Stephen Holgate, who's a champion of air pollution in the UK. And you can really see that it is an insult across the body. It's not really just the lungs, and certainly not just the heart and lungs, although that is significant. You can actually measure the respiratory growth in children, and they have decreased lung function if this is in areas of high air pollution. And the same, unfortunately, is true of their learning and neurological development. One thing that we feel is not talked about is the impact on pregnancy, and that can lead to premature birth, a decreased birth weight, as well as issues with fertility itself, the ability to conceive. And of course, there are other effects throughout the body, such as worsened impacts of diabetes and high blood pressure, all of which contribute to early morbidity and mortality. Now, in terms of bringing this home to the story of the individual, there is the tragic case of a young girl who died just about 10 years ago in London, called Ella Kissy Debra. And she was brought up in London alongside a busy street, a very busy road, and she had quite severe asthma. And unfortunately, over the course of several years, she had well over 25 significant asthma attacks requiring hospital admission, and unfortunately she died of her asthma. And in the inquest into her death, the coroner was able to map that high air pollution days had actually coincided with spikes in her air pollution, as in her asthma attacks. And it was the first time anywhere in the world that air pollution has been able to be included as a contributing cause of death in a death certificate. And, of course, this is just one example. And her mother continues to campaign about the issue of air pollution as a really strong figure as well. So the coroner's report called on many medical institutions, including the Royal Colleges, to essentially get round a table and discuss what they were going to do about it. They collectively agreed that health professionals are good messengers to deliver this information to their patients. They didn't feel that patients should be made to feel responsible for the changes required to, be solely responsible in order to decrease air pollution. They didn't feel that all health professionals needed to be seen as air quality experts, but actually, the really good thing about the messaging around air pollution is that it can be reasonably simple to health professionals and patients, because pretty much everyone across the political spectrum recognizes that air pollution is an issue if they're told about it, and then they recognize that there are things that need to be done about it, even if we don't always completely agree on what the solutions are. And lastly, they did feel that air pollution messaging would need to be tailored to different patient groups. So then comes in some of the work that Global Action Plan have been doing. Now, the National Primary Care Project is the third or one of three projects that we've run. We did one project which ran with respiratory and pediatric health professionals in secondary care. And then the National Primary Care Project looked to run with GPs from across England due to funding. And as you can see here, there is really a pretty excellent distribution of GPs who came forward to participate in the project. So yeah, we were really delighted with the response, and we had really enthusiastic clean air champions to get involved in the project. We actually, essentially, through this project, we taught our GPs and a couple of other healthcare professionals who wanted to join in too. So we taught them about air pollution in an interactive online session. Then we asked them to start talking to their patients. We produced loads of materials to give to the GPs, such as leaflets and messaging that could be put up in the screens in their practices, posters and many other materials essentially to help spread the message. And here I've just got a couple of examples. This one was a leaflet, so it's two-sided of A5, and on the first side you can see that it talks about the many health impacts of air pollution. It does say that there are things that we can do to help, and it points them towards a GAP and DEFRA run website called the Clean Air Hub, which is really a sort of patient-centered area that the patients can go to learn more about air pollution. And on the second side, it has some discrete and sort of concrete actions that patients can do to both reduce their contributions to air pollution, as well as, importantly, reducing their exposure to air pollution as well. So this is split into outdoor and indoor. And in the outdoors, it's certainly much more in the way of active travel, trying to keep away from the busy streets where the highest levels of pollutions are, and trying not to idle their engine if they do have to drive as well. When we're looking to the indoor situation, getting people to use fragrance-free, milder cleaning products, and if they are decorating, choosing to use safer paints without VOCs in them. asking people obviously not to smoke in your home, and reducing burning elsewhere as well, such as log burners, coal fires and candles, which unfortunately are really quite bad for the health of the people inside the building, but also with the case of wood burners, quite bad for the health of everyone in your local area as well. And then having done lots of these indoor things, people can choose to ventilate their home, hopefully during reasonably quiet periods in the day, so maybe not during rush hour, but doing that will help clear the air in their building as well. The second type of leaflet, and this one more focused on children, I'll not go through in so much detail, but essentially it has a lot of the same things that people can do, including actually checking the air pollution forecast. And then on the second side, it has this tick box structure, which I think GPs and patients found particularly useful when running through with, say, children and adults with asthma, as an example, because they can go through this maybe as part of their personal asthma plan and gain a sense of ownership and control in their condition to do some of the things that they can to hopefully help their overall health. Just as a quick example of some of the materials that we produced as well, you can see here a poster that you'll probably recognize as being very similar to the sort of more medically focused version. So we made this into language which is much more understandable by the general public. And then, yes, all of which is pointing towards the Clean Air Hub as a good source of information for patients. Just for everyone's information on the call, all of these materials and leaflets, etc., are freely available on the GAP website. Specifically, if you go to Action for Clean Air, or if you even just search that and looked at the health section, then you can see we've got training videos, some of which are ones recorded by myself, but also from experts such as Sir Stephen Holgate. And then there are all the leaflets, posters, the actual reports from our projects, and graphics, etc. So there's really loads there to see, and they're all freely downloadable. So the top line message that we asked our GPs to pass on to their patients, obviously air pollution seriously impacts their health. There are some things that we collectively can do to reduce it, but also importantly, there are things that people can do to reduce their exposure, even in the areas that they live. And so we took our GPs, having taught them, and asked them to pass this information on, obviously, to their patients, but also to their colleagues as clean air champions. So we gave them the materials, we asked them to speak to their patients, and sort of really, over time, understand and decide what words and phrases worked for you, because it takes time to learn these new skills. And yeah, incorporating this into their routine. Now, in terms of spreading this information to their colleagues, they were very successful at this. So having introduced it to their consultations, we asked them to share it with their practice colleagues, and many of them spoke at their weekly practice meetings. A number of them took it further, in fact, and spoke at local education meetings or even at regional meetings to train other members of staff, other types of staff. And then some really took it on and ended up speaking to, say, local schools or local politicians, etc., in order to help bring air pollution up the agenda. And that's what we would like to see on a much wider level as a consequence of our projects. Very quickly, essentially, you can see in blue here before training and orange here after training that the confidence levels in talking to patients was significantly higher. And then we can also see how would you rate your confidence levels in giving your patients advice. Again, much lower before the training. So it's certainly GAP's opinion, and indeed the opinion of the participants in the projects, that air pollution learning needs to be included in the standard pathways of learning in order to actually mainstream it. Because despite the success of our champions, this was only 40 GPs up and down the country, and GPs are always pressed for time. So it really needs to be included automatically as part of existing protocols and the learning pathways that we have. Just a couple of quotes from GPs here. I think if we're having any training on asthma or COPD, air quality and air pollution should be included in that. So it becomes a kind of standard part of education. And then secondly, if they say, if we're really serious about going to get this information used, it has to be incorporated into protocols because clinicians are just so busy and we don't have time to do yet another thing. We just forget. So despite the best will in the world, it really does need to be included automatically. As such, GAP actually, myself included, we developed a protocol document, which is just 3 pages long, and I'll very quickly brush past. Essentially, it has these key messages. It has the health impacts that we talked about, and it talked about where the patients can be sent, as well as where all of the free resources are available. On the second page, and I still really like this graphics that my colleague came out with, it talks about the many areas where you can give information to your patients. So not just during the consultation, you can actually put things up on your website, you can have automatic things in your phone systems, you can have it on social media pages, etc. And then during the consultation itself, thinking about how to integrate it into the conversation, and then think about giving the patients achievable goals in their management plan. And then also, of course, there are opportunities after the consultation, such as the patient's pharmacy. So yeah, very happy with that. And then the third and final page is just some examples of words and phrases that patients can be given, and the participants and healthcare professionals can use with their patients. So I won't go through all of these, but certainly we've got some great examples there too. So in terms of the outcomes of this project, we trained 43 clean air champions, 40 of which GPs, increasing their confidence on air pollution issues. You know, a great majority of respondents reported having spoken to their colleagues about air pollution, and a great majority had reported speaking to their patients about air pollution, keeping in mind that before the teaching, only about 7% of them had actually spoken to their patients about air pollution. Just a few important quotes here from the GPs. I was surprised actually as to how receptive people were about to hear about it, and I think they found it helpful knowing what they could do to reduce their exposure. Secondly, once people actually see that the facts and figures, people are astonished really that they haven't perhaps learned about it before, and agree that it is something that they want to talk to people about. Thirdly, it kind of felt like something she could actually do actively that could have a positive impact for her and help her feel better. And I believe that was in relation to a patient with fairly advanced COPD. That's not promising them the world that their condition is going to disappear or anything like that, but it is actually giving them some active things that they can do, because a lot of the time with people with these chronic conditions, they're essentially told, unfortunately, you know, this is your condition, this is how it's going to be. And then lastly, they were quite receptive to thinking about how even just things like, you know, trying to walk on different streets at different times and trying to reduce their direct risk to air pollution. And, you know, they were interested in that. So yeah, really great quotes there directly from our GPs. So the GPs as champions, as I said, they shared this information far and wide, which included talks at their primary care networks, teaching to registrars, nurses and pharmacists, amongst others, and then of course during their weekly practice meetings. There was even an article published with the British Geriatric Society, as well as local and regional newsletters for healthcare. And then the resources were shared to lots of colleagues through WhatsApp and other messaging groups like the Greener Practice Network. One GP in particular, for example, sent out a text message to pretty much all of their patients, which was about 23,000 patients. So that was really amazing in terms of getting the message out there. So yeah, having, for the most part, concentrated this project on GPs, we really found that teaching the whole workforce is going to be supremely important if we're going to get this message really out there and educate our population. This GP said it's quite difficult to engage patients with the time restrictions, of course, GPs being so short on time. But sharing with the nurses who are doing the end of year care reviews with patients have more time to discuss the triggers for their conditions, including pollution. So yeah, a really important message there. And then one point about sort of making sure that everyone is reading from the same page when we're giving this health information to patients. One GP said that a patient's specialist, their respiratory consultant, had actually already mentioned air pollution to her. So it felt really good to, sort of bring this message from multiple angles to the patients to really bring the message home. So our key learning points from this project is that GPs are keen to learn about air pollution. The resources definitely help to spread the message. Learning to communicate about air pollution does take time and practice. I mean, this project ran over 4 months of the GPs speaking to their patients, and we did have a lot of them say that, it was taking time and they were getting it into their practice. And of course, GPs are wanting training on air pollution included systemically. Now, just briefly, I'm going to mention a very similar project that we were running just on a couple of slides, in specifically the borough of Islington. So this project was interesting in the sense that instead of across the whole of England, it was very much focused on this one population. And in this project, we trained 17 GPs, nurses and pharmacists, so a broader range of staff members. And it was interesting to note that recruitment was a bit more difficult in this relatively small area, but we still had a great team of champions. We did also have other elements to this project, including surveys of patients outside of the practice. So we specifically surveyed patients with pre-existing health conditions such as COPD, asthma, cardiovascular disease, etc. And this was 186 before the healthcare professionals were taught and about 134 after. There was also a pretty significant concurrent communications health campaign across the borough about air pollution at the same time. We made a wearable air pollution monitor video with some GPs participating in the project, which went down really well and was pushed out on social media. And we also had other elements of social media, and we had images go on electronic banners and bus shelters. We had physical banners going outside schools and some GP practices. And then also we had pretty much all of the screens, the sort of turning over screens in the council buildings, because this project ran with Islington Council as a partnership. So there was a really wide impact there from this communications campaign. Just as a couple of example images, we had 2 images relating to idling, which went round as part of this campaign. So focusing on the pregnant mother here, of course, and then looking at a young family. And both of these images were quite popular really in social media and were shown around the borough. So I'll just focus on the findings from this study, which were different, in addition to the ones from the National GP project. So we of course saw similar improvements in confidence and knowledge amongst healthcare staff, but we also could actually categorize increased knowledge and understanding among patients from the surveys. In a number of metrics, we could see that the knowledge about air pollution as an issue in the UK and a cause of different health conditions had gone up as a consequence either of advice from a healthcare professional or from the wider communications campaign. Now, this really great statistic here is that 52% of patients in the second round of interviews, the ones who had received advice from a GP had decided to take some form of action, which in the most popular ones was ventilating more while cooking and cleaning, walking or cycling, using public transport more, and using less polluted routes for their journeys. So that's all really great actions that we would love to see more of. And we could specifically say that patients were twice as likely to take action if they had received advice and seen the public health campaign. So really approaching the issue from multiple angles with a support from a wider communications campaign is really the way to get, to bring this home to patients. So after all of these pilot projects that we've run in order to demonstrate, that healthcare professionals are a great medium to bring this information to patients, we have some recommendations. We think that one option is perhaps repeating a similar study, but on a larger scale and on a deeper scale, meaning that you automatically include every healthcare professional across a primary care network or in a trust or even in an ICS region, so that you have top-down buy-in from the board level all the way down to the staff on the front line, and then you could really see how that improves the situation. If we had widespread and a deep public health campaign to support the health professionals giving this advice, we can see that public health campaigns lead to increased knowledge and understanding about air pollution. We could test the independent use of this newly developed air pollution protocol that I showed you here, as well as perhaps some of our other materials. And then we could look to see whether GP engagement leads to long-term behavior change, because it was difficult to assess long-term behavior change given that the project ran for about 4 months or so. Often, of course, as well, the GPs will not necessarily see the same patients until maybe a year later or so. We really do feel and desire that air pollution learning really needs to be embedded within the undergraduate and postgraduate curricula across different health conditions and the learning for them. And we have GAP resources that can help with this as well. And then particularly what we found, say, working with the local authority, quite in a close partnership in Islington, is that you can really reach the population better. And that was really shown in terms of the hundreds of screens that they had across the whole borough. So we really want to see greater NHS, local authority and government action and collaboration on air pollution, because that localized information is, it's well received by staff and patients. The GPs and healthcare staff in Islington were very keen to see what the localized air pollution levels were like where they lived and worked, because that's great information to pass on to their patients. So just as a final potential resource for you, I think a really useful website that's not run by GAP or ourselves, called addresspollution.org. And if you're seeing patients yourself, then you can actually just type in their postcode and look at what the air pollution level is like with the best data available up to that point. So it's a really, really useful resource if you're speaking to patients. And yeah, that's it. Thank you very much. So we've now got a discussion for about 20 minutes or so, and we'd really love to hear your questions, but also what your organization is doing in terms of air pollution and what more you can do as we move this agenda forward. So thanks very much, and I will stop sharing the screen.
Thank you. Thanks, Malcolm. There's a couple of questions in the chat which I can go to, but then if anyone wants to put their hand up and ask a question, or post a question in the chat as well, we'll go there. I'll go. Thanks, Debbie. I'll just go to the first one in the chat first, and then over to you. So there's a question from Arabella Daniel. It says, "You've said transport is the leading source of outdoor air pollution. Isn't wood heating the leading source of PM2.5 in the UK?" And there's been a couple of comments about wood burning and advising people to take quieter streets, but those quieter streets might then be polluted with smoke from chimneys and things. So that was a question that a few people had mentioned. I don't know if that's something you want to...
Yeah, I'll jump in quickly first, and then I think Larissa might have other elements to say about that perhaps. But all air pollution is pollution, and it's all harmful to human health, so all of it needs to be tackled really. You can certainly say that with a wood burner it produces more particulate matter than an HGV. It is really significant and very harmful to human health. So certainly GAP at some point and others are pushing towards calling on bans effectively in urban settings, but we're not in that position currently. What we would say And if you're speaking to a patient and they're talking about their wood burner, then you do need to have people on side. You can't immediately alienate them and say, I'm sorry, you're the enemy, because they're not going to jump on board with that. But what you can say is, look, wood burners, we really want you to try and burn them as little as possible, because it's harmful to your health, like literally where you're sitting, as well as the health of people in your community. And although people sort of might believe that it's a more efficient way of heating your home, that really hasn't been proven, sort of in a way that we would agree with. So I think that there's a lot to be said for that. But certainly transport is still the biggest cause of air pollution in general across the UK, and it is a massive contributor. So it's unfortunately not just transferring everyone to an electric car. It is actually reducing the number of journeys being taken. It's changing the method into much more public transport and active travel. So there's just much more in the way of health benefits for everyone, of course, the more that we do this. Did you have anything to say about that, Larissa? Sorry.
Just on a technical point, I think there's so many pollutants is the thing. So transport is the largest cause of nitrogen dioxide pollution. I think transport is about the third biggest contributor to particulate matter pollution in the UK. The biggest source is industry, and the second biggest source is domestic burning. And it is the domestic burning issue is something that isn't being talked about. It's the thing that the public know least about. Even people with wood burners, only about 8% of people recognise them as a source of pollution. I don't quite get that. You can see the smoke. Surely people make that equation, but they're not. There's very poor public understanding about it. So we've got a lot of work to do in terms of just letting people know that A, wood burners are a source of air pollution, B, that essentially if you can smell smoke, you're smelling pollution, and then C, getting on to asking people to do something about it. The majority of burners in urban areas in the UK, for them it's a secondary source of heat. It is often a more of a nice to have thing. It's a different story in rural areas where people are off grid. But it is challenging in an energy crisis and a cost of living crisis. We've been doing quite a bit of market research, message testing with the public, and during that testing period, the sort of energy price hike came in, and it's made it much more difficult to talk about air pollution and domestic burning, and the message around use it less. Some people are like, well, it's just going to be cheaper to use it, and no one's actually done the maths, but I don't think it is necessarily cheaper well, definitely not if you're going to install a burner and then use it, but even buying wood isn't cheap, plus the maintenance, plus it's not heating radiators to do things like dry towels. So if you're then looking at sort of the on costs of using tumble dryers and so on, we need to do the maths, but I don't think it's as straightforward as the Stove Industry Alliance and their messaging that they've put out recently suggests. So there will be more on that coming from Global Action Plan in the new year. We are going to be running a little campaign in London, a sort of pilot campaign, and are doing some economic analysis of the costs of central heating versus domestic burning. But just even to have health professionals mentioning that it is a source of air pollution is a good start, because levels of public understanding are very low.
Thank you. Debbie, do you have a question?
Hi, thanks, Elaine. That's an interesting discussion around the wood burning, because I always tend to assume that we're a little bit behind the curve in Ireland compared to the UK. But we've had this issue with peat here. And of course, with peat, there's a whole issue around biodiversity. So this argument has been going on for some time now. And we also have 40% of the population who live rurally. So a lot of people are very dependent on their wood burners. So we've now got not adequate, but we do have in place retrofitting for homes, and quite a strong campaign to discourage people from burning wood biomass, or peat is actually illegal now. It's illegal to sell it. So we're kind of moving forward a bit with that. But I suppose I just wanted to kind of raise the issue of health professionals as advocates, because much of this discussion has been about how we can try and mitigate the impacts of air pollution. But I do think as health, we also need to be involved in these wider discussions. It's a bit like, it's the usual public health argument. We need to do something about why people are falling in the river in the first place, and that means really being active advocates around traffic and reducing traffic pollution. I'd be interested to know whether people see that as a health professional role, or how we might do that more effectively by linking health with air pollution.
I can come in on that on behalf of the UK Health Alliance. It's certainly an area that we are looking at this year. We've and I see Ruth from Partnership for Active Travel and Transport is here as well. So there are a few groups working on looking at this and seeing what role we can play, and we've had some conversations around that. So I think it is something that we will be doing hopefully a bit more of over the next year. I totally agree. I think health and the health voice needs to be active and prominent in a lot of areas: housing, transport, everything that impacts on health. So yes, we will be doing more on that.
Yeah. I would just double down for like 5 seconds to really say that don't underestimate how powerful the voice of healthcare professionals is when approaching like local authorities or government or anything like that, because just saying doctor this or I'm a nurse and I've got 10 years experience and all of these things makes it a really powerful voice. So I just want to double down on that. Yeah,
and as well, if we're advising, if we're encouraging GPs to advise their patients to travel actively and to walk, and sometimes the infrastructure isn't there for people, and that's particularly true in deprived areas where people don't have access to green space or good quality, safe green space. So, there's that side of it as well that needs to be there for people to be able to do these things. Shweta, did you want to come in?
Yes, thank you so much. This is so exciting and inspiring, and in a lot of ways, this is very similar to something that we have done. And just to add on to the power of the health voice, before I go into like what project we did in India, truly, I think health professionals, with the data that they have in terms of air quality monitoring and the information that they can disseminate to their patients, are also playing a very active role in urban planning, in decision making. And one example that comes to my mind, and this was particularly personal because we worked with a prominent lung specialist in Chennai on a similar kind of a project, and he started advocating his patients to like take walks after looking at air quality in the city. And so we found out that it was 8:30 p.m. in a coastal city like Chennai that you could go out for a walk. And 8:30 p.m. means like you have to have road safety, you have to have street lights, you should feel safe. And a lot of patients did not feel safe and came back to him saying that we don't have street lights. He wrote to the municipal corporation saying, provide infrastructure for my patients, otherwise they are going to be sick. And it worked. It worked like overnight, where in communities where people were petitioning for like months, a doctor's voice adding that as a prescription really worked. So, I don't know, it's, I feel like this gives me confidence that bringing a health voice, a credible voice, a reputed voice from your neighborhood into these decision makers really like sort of turn the conversation.
That's brilliant. Thanks for letting us know about that. Really great. And nice to meet you as well, Shweta. Sorry, I noticed, Elaine, Alice Harper, you've got your hand up, and then maybe we've got time for a couple more of the questions from the chat.
Hi, thanks so much. That was a really interesting talk and some really great resources to signpost to. I just wondered, I guess, on the same line of kind of using the voice of healthcare professionals, and especially around those patient conversations, just to get your reflections on. And I know there won't be kind of a nice, clear, neat answer, but I'd be interested to hear your thoughts on air pollution. Is obviously a really important topic, and especially in the context of thinking about how you educate people to reduce their exposure if they've got underlying conditions that might trigger. But I'm conscious that within the kind of climate change and sustainability work, we're also asking clinicians to think about their prescribing practices and how that impacts, and maybe have conversations about kind of food choices and sustainable diets, thinking about single-use items. And it's I guess what are your thoughts on how we challenge and empower healthcare professionals to think about these messages and have conversations and think about their practice, but in a way that isn't kind of every different topic coming in with another leaflet or another set of videos? Or what are your thoughts on how we unite that or make it digestible?
Yeah, great question. Thank you. So I think, first of all, a lot of the solutions to the numerous problems that you described there are very similar, as in so even though numbers of people are coming at the overall issue of sustainability from different angles, ultimately the changes that need to happen in a lot of the cases are quite similar. I also think in some senses this comes from ground up action, as in someone who has a passion for doing something in an area will help make a change, and that's what we see from this champions model, which is really, really good. But another element of it is feeling supported from the top up as well. So if your entire primary care network has a sustainability strategy which actually addresses all of these things and talks about air pollution and talks about these things, then you're backed up. Then you can sort of really go for this. So people may well be familiar with ICSs, or integrated care systems, which is a new set of entities across England. Sorry, just specifically talking about England in this instance, but it's trying to increase the collaboration between local authorities, secondary care, primary care, and all of these institutions have to have a green plan which looks at decarbonisation and does mention things like air pollution as well. So I think knowing that a lot of these institutions might have a sustainability strategy already is a useful thing, because then you can go to them and say, where is your sustainability strategy? I'd like to see it. I'd like to talk to you about it. I would like to see where you're making progress on it. And actually, showing that there is great support from the frontline workers in this sort of situation, I think would do a lot of work towards that as well. So not a perfect answer, but I hope it addresses it somewhat.
I was just going to quickly jump in there as well. I think what's key as well is embedding sustainability across all aspects of it within the undergraduate, the postgraduate training across every area of healthcare. How health professionals are revalidated, so getting it into good medical practice for doctors. So it's part of what you do as opposed to add-ons. I think that's critical within everything. It needs to be embedded now. I'll go to another question from the chat. It's from Ruth, and it's specifically about the Islington work. Do you know what impact the campaign in Islington had on increasing active travel?
So I think that was mentioned in terms of, so if you imagine there was 130 odd patients who were interviewed in the second half of that, and only a certain number of those had advice from their patients. This was also quite a select group of patients in terms of these were ones with pre-existing health conditions. So patients who didn't have them were screened out, which is just a way to collect data essentially. So of those patients, only a certain number of those had air pollution, and of those patients, a certain number of those had said that active travel was part of their choices that they'd made in behavior change. But there is a small number that you can say have increased their active travel, but I don't think you can really apply that to the whole particularly. So yes, but no is my answer.
Thanks. Oh, shall I go for another question? I'm conscious we're running out of time.
Exactly. Let's maybe squeeze in one more, and then we can sort of pull it together a bit.
Okay, so Kate Forster, who I think is joining from Australia, am I right? Has there been research on which messages are most effective at giving people a good understanding and motivating behaviour change around air pollution?
I think from our studies, most of the research in terms of what most of the evidence in terms of what messages patients really resonated with was sort of anecdotal from the healthcare professionals. They tended to talk about the actual actions that they could take, both on outdoor and indoor air pollution, as things that resonated well with them. But in terms of inspiring long-term behavior change, it's difficult, as I said, because it's a reasonably short project. So yeah, I think in general they were widely quite interested, but this is a reasonably self-selecting population in some senses, because the GPs will have picked the appropriate patients to have this conversation with to some degree, rather than just, oh, so spoken to every single patient who came through the door about air pollution. That isn't going to happen anytime soon, and wasn't reflected in the study either.
And just to jump in there, if I may, there's no academic research, to the best of our knowledge. If there was, we'd be using it. So, but what we do have is sort of the messaging that we've been developing and honing for Clean Air Day, which we developed with the UK Health Security Agency, with various academic health professionals, and that goes out, I suppose, in the field to be used each year, and then that sort of gets honed and refined given the impact it has. And you can see in our celebration report for Clean Air Day 2022 how that sort of campaign and that messaging has led to a shift in public understanding about air pollution. It has led to a shift in behaviours, air pollution positive behaviours. So there's something in there, but it does need proper academic analysis, and it also depends. I mean, air pollution is so big, there's so many pollutants and so many actions related to it. Almost you need to sort of take a very specific approach for each area of it. So as part of our domestic burning campaign, we're doing a lot of public research as part of that, doing message testing, and it's very interesting what comes back, because we were sort of all gung-ho, let's put messaging on there telling people not to burn as much or not to buy a burner, and people are like, don't tell us what to do. We don't even know that it's a problem yet. We'll just feel judged if you put out messaging telling us what to do. So at this stage, just tell us what the problem is, give us the information, the facts, nothing else. Let us make up our own minds. So it's interesting what the public actually thinks and responds to. They responded very badly to messages that said burn less, and they said that would turn them off, and they might in fact do the opposite. They would just give us the facts, let us make up our own mind. So each campaign and issue sort of does need its own research in order to make sure that you get the messaging right for that specific ask. But yeah, it would be great to have more research in this area. We're a project-based charity. It's something that would require a lot more budget than we often have. So if anyone would like to partner, we do partner with academics. You can take the data and do something with it. That'd be super.
Yeah. Okay, so I'm just conscious of time and we're about to wrap up. So I kind of a couple of small points. Now, I do notice a couple of very good points from, say, Ruth Gellety there. Talking about it's a bit of a burden to have healthcare professionals be the ones who drive this all the time, but at the same time, whatever you can do will help is a good point there. And raising awareness about air pollution is helping to generate political support locally for active travel and clean air policies. So yeah, I think that there is a lot to be said about the medical voice and the other healthcare professional voices, of course, as well. And then, just because we're essentially running out of time, what we'd really love for yourselves to do, the people on the call here, if you're here representing an organization, or if you're here as a student, or like with a body in its own right, like go to those go to the leaders of these institutions and actually ask them, what are you doing in terms of increasing education and awareness about air pollution? Because that actually, you know, instead of just having 30 odd people, 40, 50 learning about this on the call, that's how we sort of take this champions approach in a sense and ask you to start applying it in your own practice. Is yeah, so do it with patients, do it with your colleagues, do it with your staff, like bring this information to them, and challenge those who are leading your organizations to do more. Right, so I think we should probably leave it at that because it's a minute past our allotted time, but just wanted to say thank you to the UK HACC for having us. It was really great to speak to you all about air pollution, and very, very nice to meet you all. Yeah, I think that would be us, so thank you very much.
Thank you. Thanks, Malcolm. Thanks, Rissa. Thanks, everybody.
Thank you. I enjoy the silent
you.
applause. Okay, right. All the best, everyone. Thank you very much.
Thank you. Bye-bye.